We're all in this together, and we all must be part of this solution. We have to avoid the worst-case scenario at all costs, and I can assure you we are prepared to do whatever it takes to stop the spread of this virus before it takes a greater toll on our loved ones. Tomorrow, our government will release further public health restrictions based on the best medical advice. And as it's looking, these measures, they will have to be tough in the hardest hit areas. We're seeing concerning trends. Our hospital ICUs are in jeopardy. Our long-term care homes are at risk. We have some difficult but necessary decisions to make. But today, I'm asking the people of Ontario to listen, especially with the holidays quickly approaching. We can still head off the worst. We can still protect our hospitals and long-term care homes if we follow the public health measures. The backlog surgeries, we're going to continue. We increased capacity on both ICU and acute care. I believe it's 2,350 more beds, and I could be wrong, but I believe it's pretty close to 2,350. And we're going to continue adding surge capacity within the hospitals.
Today, Critical Care Services Ontario reported the ICU threshold of 150 COVID patients has been reached, and it released this data well in advance of the province releasing its data. And we wanted to ask why that's happening.
The data, there's two forms, as we've done in the past with administration from sectors. So we have the critical care data, and they collect that. And the combination between the two, as you see, there's a slight difference between the two numbers, delays in reporting and how that goes forward. So if there's slight differences, we look at those, we try to address and get them as consistent as possible. If it's a difference of, say, 5 or 10, it's one thing, it's just a delay in reporting. If it's huge, then we have to look at what has happened in our processes and systems to make sure we're more congruent and consistent with our data reporting.